I was waiting for our good afternoon, everyone, and welcome to today's Advantage Workshop. So AI is coming. In every conversation I've had in the past 2 years, many organizations are talking about the challenges they're having with this new technology, and many leaders are not sure how to navigate it, which is why we're here today. I'm excited to introduce Carol W. Kamangu, CEO of the Dumontel Healthcare Consultancy. Carol, you are a nurse epidemiologist, over 15 years of experience helping healthcare systems navigate these challenging circumstances and building stronger and more resilient systems. Enough about me yapping. Carol, show's yours.
Thanks, Lorraine. This is a great opportunity for me to share what I know. And as you said, AI is a big conversation. I get a lot of questions. And for my audience, I'd like to preface I'm not a tech expert, but everyone in healthcare finds themselves at this crossroad where we all need to use AI. And I'm strong on the operational side, and I'm part of a board of directors. So I have that firsthand experience working with boards and also work with executives and operational leaders. So I believe this is a good time for us to discuss this topic on AI readiness in healthcare operation, not the tool tech or the technical skills, but really what leaders are expected to do and to know to make sure that their organizations are stronger when they adopt AI. Without further ado, I'd like to start with my slides so we can go over this. So I titled this presentation AI Readiness in Healthcare Operations, What Leaders Must Do Now. Because AI is here to stay, it's already happening, just like when we had the internet boom, we can't go back. So we need to move forward and figure out how to make this work for us. So we can go to the next slide. So some of the key takeaways I'd love the audience to get is to evaluate whether our organization's AI strategy is built on governance and leadership alignment rather than just focusing on what tool we want to adopt and how to adopt it. And also distinguishing areas where AI is already showing a measurable impact and a return on investment in healthcare operation and where adoption is still taking a little time to evolve, and also understanding why it's important to have a strong leadership structure, infrastructure and governance, not just focusing on here's the technology, let's learn how to use ChatGPT as an example, and also know what the difference is. And the last key takeaway I'd like for us to understand where our organizations truly stand on AI readiness and what that really means for leaders when they make their decisions to adopt a specific system. So the truth about AI readiness is it's not really about the technical knowledge. Many of our leaders here, whether you from a board of directors or an executive or a clinical leader, operational leader, we all have technical skills that we've learned in school. We have our degrees on, but AI is not really about us becoming tech experts. It's not even about our operations. It's really about our responsibility as leaders. We go to the next one. So the responsibilities of leaders, and I decided to go with three different groups of leaders. We have our enterprise leaders, those are our CNOs, CMOs, CEOs, VPs, even owners of healthcare organizations, and our operational leaders. And for our audience here, I know we have leaders from surgical services, infection prevention, quality. We have medical doctors, we have nursing managers, also our technology leaders with thinking about IT, our IT department. So our enterprise leaders' role is really to establish the safety and governance guidelines to know how the organization will implement and adopt a new AI tool without endangering patient information or even the trade secrets of the organization. And our operational leaders' role is really to ensure that AI is adopted in a way that is safe and also integrated smoothly within our workflows. Our technology leaders' role is to make sure they have all the guardrails established from the get-go and make sure that as our staff, our leaders are using AI, that they continue to monitor that it is used safely and according to the guidelines established by enterprise leaders. And before I go to the next slide, sometimes you'll hear me pause. It's just because I'm a multilingual individual. I speak French, so sometimes French and English compete in my brain. So that's just why I'm pausing. So just so you understand why I take some long pauses sometimes. So we can go to the next slide. So I'd like to do a pulse check with our audience here. I'll have some 3 slides on the screen where I want to share what our feel is about AI here. So we have a QR code on the screen. I'd love for you to connect with your smartphones. And if you're unable to take a shot of the QR code, you can get the link, the URL at the bottom on Mentimeter. And we're going to switch here just for a second. I'd like for you to see the data, so I will present it to you on my screen. I'm not able to hear you or to see you, so I hope you can see the screen. So this is on Mentimeter. I'd like to see once we start responding what we are seeing. So my first question for all of our leaders in the audience is, as a leader, do you feel fully prepared to adopt AI on a large scale within your organization? Not just one department, but the entire organization. Do you feel ready? I'll give a few seconds here to see if we have more people responding. Okay, the responses are starting to come in. As of now, 100% say, no, we still have a lot to learn. And I totally agree with that. None of us are experts with AI. We're all learning about this. Yes. Oh, so far, it's still 100%. Okay. Oh, wow. Okay. We have more responses coming in, so we'll just wait a few seconds here. This is interesting. I'm very glad to see that no one says, yes, we are set up and ready to go. It's even studies shows that there is not 100% of organizations out there that are very ready for AI. So this is really showing us what's truly happening, and we're all being very transparent here that we still have a lot to learn. So this is good. Excuse me. Okay, so it looks like our response is yes, it's 100%. Most of us know we have a lot to learn. My second question is, what percentage of your operations has already integrated AI in any form? So let's say that we have 2 people who responded already, less than 5%. Okay, let's keep going. Let's see more responses here. I'm curious to see who has already 50 to 90% integration of AI. And I know our connection is a little slow, so we'll wait a few more seconds here. Aha. Some are at above 5%. That's pretty good. We're still under 20% here. Very interesting. Keep sending your answers. I'm still waiting. Ah, okay. Our pie chart is changing here. Oh, We have one organization is already at 50% deployment. Okay. Very cool. Is there anyone with 50 to 90%? No one here? We have 60% of the votes. So with 60% of the votes, we see that three of them, 3 out of 10. Okay, we're still moving here. Okay, 70%. Okay. So 40% of our audience is still at less than 5%. Yeah, so the majority of the organizations have not fully deployed AI. And right from our audience here, we have uh, only 10% that's at 50% deployment. My last question is, in one word, can you describe how you feel about adopting AI on a large scale within your organization? Any feeling, there's no judgment here. If you feel scared, you can say that. If you feel excited, you can say that. If you feel nervous, we need to know that as well. As for me, I have mixed feelings. I'm excited and nervous. And from a risk management standpoint, I believe that's the right stance to have, being excited but nervous. We need to be cautious with everything we adopt, especially new technology. Nervous and excited, okay. Who is scared? Who's genuinely scared? Worried. Oh, okay. We have some people who are worried here. Okay. We need more responses. Okay. They're coming in. Hesitant. Okay. I want to see if there's anyone who's reluctant. I don't see reluctant yet. So it looks like we have some positive feelings here. Overwhelmed. That's one of the feelings I hear a lot from leaders. I'm overwhelmed with AI. There's so much out there, so many tools, so many opportunities. Where do I even start this? Overwhelmed and unsure are our strongest feelings here. Mm. Overwhelmed, yes. Looks like we're mostly overwhelmed than anything else. I'm waiting for one more. Okay, it looks like the responses stop coming in. So 60% responded. So we're mostly overwhelmed and mostly unsure, but we are still excited, anxious, nervous, worried, annoyed. Oh, annoyed. I didn't see that. Annoyed and hesitant. I'd love to speak to the person who's annoyed. I'm very curious to hear about this. Thank you all for sending these answers. This is very, very enlightening. So let's go to the next slide. Let's pass all of our poll questions. Yes. So now AI, as I was saying, AI is already here and we know it's here to stay. So let's find out what's really already happening with AI in our healthcare operations. So AI is already being adopted from our clinical teams, operational leadership, and also administrative functions. We have scheduling that already utilizes AI, clinical decision making in some places. Operational, we have surveillance that's already using AI for better accuracy. Unfortunately, our governance structures are not really keeping pace with adoption. There are multiple studies that show that medical doctors, nurses, nurse managers, even from conversations I'm having with other leaders, they're already hearing there may be one person in their organization that's already using AI and there's no governance structure. The IT department is not even aware. Only that person's manager finds out, and now they have to figure out how do we make sure we have a policy for AI use within the organization. So that already shows that many of our healthcare organizations already have AI readiness gaps. And health systems are increasingly experimenting for the majority of us, we are experimenting with AI tools. It's just finding out how to integrate it smoothly within our operation that's still inconsistent across the board. And the majority of organizations from a few studies report that they're actively using or exploring how to use AI, but with at least one application. And that may be with ChatGPT or Copilot 365 or their own organization's created AI application or a specific department within the organization, but there are no or governance structures or safety data that's already been put in place. Next slide, please. And since the majority of our audience here works in surgical services, I also wanted to share what's happening in the surgical world. And AI is already being embedded in clinical tools, clinical decision making, supporting imaging, documentation, surveillance, as I mentioned previously. And with clinical decision making, some organizations have not been transparent yet with patients, so patients do not understand yet that their clinicians are using AI to help with decision making. And in the surgical environment, the use of AI is one of the most sensitive areas because, excuse me, because of patient safety and also the fact that using AI decisions in the clinical world has a real-time impact. So if the clinicians focuses on the AI output without using critical thinking, that may have serious repercussions on the patient and on the organization, especially from a liability standpoint. And as I was explaining earlier, the adoption, even in surgical services, is going way faster than the organization can integrate with their own standards or having a framework from a governance and safety standpoint. Next slide, please. So these are some of the practical applications of AI in healthcare operations, and this includes surgical services as well. As surgical site infection surveillance can be used with AI, and it's been have been in some conferences where I've seen a few experts who have experimented with surgical site infection definitions from NHSN, seeing that it was extremely accurate. So it's easier to identify patterns of infections very quick. And the return on investment in using AI in surveillance, it helps achieve 90% of sensitivity and more than 90% reduction in the workload of the individual doing the surveillance. And there's also, it's also being used to automate our workflows, especially with pre-op screening. It helps stratify risk for our patients, especially for elective procedures. And there are also some studies that shows that reports that were generated by AI are showing 15% more accuracy than what's written by a surgeon. So the robots, so to speak, are being even more accurate than the clinicians at this point. It helps the clinicians prepare for their cases and also reduce the risk in the intraoperative department. And from environmental monitoring also is using AI just to flag infection risks, which goes hand in hand with surveillance. And that's done in the OR environment. It helps reduce costs for patient care and also helps reduce the healthcare workers' workload. And the last thing is it helps with optimizing scheduling, especially with optimizing throughputs and reducing delays and bottlenecks. So that just helps us optimize our workflows in the surgical department. Next slide, please. So some areas where we see a measurable impact in healthcare versus a slow evolution in the adoption of AI. The measurable impact is, could we go to the next slide, please? We see that our workflows are automated and the clinical documentation is going a little faster because we using data coming from the AI tools. We don't need to sit down for multiple hours trying to diagnose or change our workflow or realize what do I do next, because AI has already received the data on how to optimize that. And it also helps with data management and predictive analytics. And also with research, AI is used in research in many areas, many industries beyond healthcare at this point, because it helps gather resources and sources within one prompt instead of going as we used to do long literature reviews. AI is able to bring out all the resources and the sources within one prompt and one output, and it helps do infection surveillance in high volume settings. As a human being, we if we have learned how to analyze data, it is possible for data analytics department to do some surveillance, but with AI, it's going a little faster because AI can now review high volume data very quick, much quicker than a human can. And machine learning powered surveillance is reducing our workload, human workload, by 90% at this point. And the return on investment is now at an average of $3.20 for every dollar invested within 14 months with an AI platform. And where we see a slow evolution, which is really understandable in the healthcare realm, is we still have governance issues with protecting personal identifiable information for our patients, our personal health information, and also data privacy gaps. And that's not just for patient information, but also enterprise information. Once that information is fed into an AI tool, there's always a risk that all your trade secrets can go outside. If we have two clinics that are competing within a certain geographical area, once that information is within your AI platform, there's always a risk that it may be leaked. And only 50% of US adults at the moment are comfortable with AI diagnosing them. And as I mentioned previously, not all patients are aware yet that their organizations are using AI in diagnosis. So you really have to pay attention to your patient visit notes to see if that's really what your clinicians have written or if it is AI diagnosing you. And for us, with the trained eye in the healthcare world, we have a better idea, better understanding of whether it is AI or our clinicians that made the diagnosis. And as far as FDA approval of AI tools, at this moment, as far as the last information I've been able to gather, it's very focused on imaging and it's not widely adopted. And as we've seen with our audience here, we're still at 5% for the majority of us utilizing and adopting AI within our organizations. And one main issue with AI at this point that is discussed widely in many industries is equity gaps. Multiple AI systems are being trained and they don't necessarily address the patient population that's being served by, let's say, your specific organization or in the specific region. So there's still equity issues with AI adoption in the healthcare setting. We can go to the next slide. So some of the things leaders misunderstand or underestimate about AI and what it can cost to your organization. Can we go to the next slide? So we have three different gaps that I've identified. We have the governance gap, accountability gap, and also equity gap. As I was mentioning earlier, with equity gap, we still have AI platform or tools that are still trained on data that doesn't really reflect the patient population. And you can, even as an individual, just do a test. Let's say you're a female or you're a minority. You can try and play with an AI tool, and you will identify those gaps really fast. There was a news paper that came out recently where there was a lady, I can't remember what university, but she was in a tech program that identified that a specific AI tool her organization was using could not identify a female with a brown face. So we see that there are equity gaps in any domain with AI. So we need to be very careful, especially in healthcare, because we're taking care of different population. And as leaders, it's very important to assess the equity gaps that we may have with the AI platforms we're adopting. And the accountability gap is a real problem at this point. There's a term being used in the tech world called shadow AI. That's where we have members of the workforce that use different AI tools mainly the ones that they're comfortable with that have not been vetted by the organization because they feel comfortable. So let's say shadow AI, how shadow AI would look in your organization. Let's say, for example, your healthcare facility has adopted Copilot 365, and we have nursing managers that use ChatGPT because that's the platform that they know and they're more comfortable with. So that's shadow AI, and that's a big problem because then they are using the patient information in a tool that has not been vetted at the organizational level. And the governance gap is the most important thing that should be the base and the foundation of AI adoption. What we're saying is that many organizations are focusing mostly on how can we use this tool. If we adopt this tool, how many people do we not have to hire, or how many people can we get rid of from an FTE standpoint? But thinking about tools before policy and accountability is a very bad decision to make. So let's talk first about the roots. What is the foundation before we even adopt an AI tool? Next slide, please. And some of the limitations, as I mentioned previously, we're still at the experimental phase in many domains. So healthcare leaders may feel like we are behind, but we're not behind because everyone is experimenting with this. We have, of course, our AI experts who've been using this since the early 2000, but for the rest of us, everyone is still experimenting. And in healthcare, we have three concerns. It's still governance, accountability, and integrating it within our workflows to make sure that patient care is still provided in a way that's smooth instead of coming and interrupting our operations. And some of the other limitations we see are the data can be fragmented, and we have stringent regulations that limit also how we can scale or adopt AI within our organizations. And the equity gaps keep coming back because we have a lot of AI trained data sets that do not really reflect our patient population. And our clinical staff, as we all know, they are burned out. So once you burn out learning something new, a new tool, a new platform, a new training can make it very hard to scale within your organization. And the last thing, which is a limitation, is really who owns the risk. When we adopt AI within a healthcare organization, within our surgical department, within our infection prevention department, or within our sterile processing department, who really owns the risk? Is it our CEO? Is it our CNO? Is it our CMO? Who is it? So next slide, please. So three of the risks we really need to be aware of and recognize as leaders is there's a risk of data and security exposure. So there's always a potential that data will be leaked. So it is important for when we establish governance framework that the policies really identify what can and cannot do, what data should and should not be used within the adopted AI tool within the organization. And shadow AI needs to be monitored. So that would be the responsibility of our technology leader. As we remember, our three pillars of leadership I was mentioning earlier. So shadow AI use will really be under the purview of the technology leadership. And also making sure that there's no department that's integrating a new AI system without approval within the policy of the organization. The second risk will be a loss of clinical reliability. And as we know, as human, with any technological advancement, humans get lazy. And I'm not excluding myself. We all get very lazy. Once we had the automated vacuum cleaners, we don't want to vacuum anymore. Once we have AI, we don't want to think anymore. So it's very important at this point, as leaders, as we establish our governance framework, that we make sure that our clinicians, our frontline leaders, operational leaders, talk to their teams so they don't overly rely on AI outputs without using critical thinking, because that's what brings us to this conversation where multiple healthcare workers believe that their jobs will disappear because of AI. So we need to keep the critical thinking as part of the organizational culture. And also we need to make sure that if there is decision making done with AI assisted tools or systems or platforms, that we have in our governance, in our data, in our policies, that the humans will have to vet that information, will have to validate it before it is disseminated or used in clinical decision making. And the last risk is at the system level. We have leaders on this call, so I believe that this is really under our purview for all of us. If AI is adopted in a way that's not safe or responsible, there would be a damage for the reputation of our organization that would lead to financial loss and the loss of patient trust. We already have, with misinformation and disinformation and the COVID pandemic, we've lost a lot of trust from the public. Patients don't trust healthcare, they don't trust public health. So AI adds another level of risk to the system reputation. So how does readiness look like? Can we go to the next slide? We want to make sure we have documented use of AI. We decide what our use cases will be within our specific organization, and we establish policies according to those use cases, and we scale up as the needs evolve. And we also want to make sure we have a structure with accountability. Who owns the risk of using AI within the whole organization and within every single department? And having a readiness checklist is also very important, because then you have a better idea of where you stand. Let's go to the next slide, please. So before we part ways, I have 5 questions I'd like leaders on this call to go away with, and you can take a screenshot if you're interested. We want to make sure we ask ourselves: are we operationally ready to adopt AI, or are we simply interested in being technologically advanced or looking or appearing like we advanced technologically? Because right now, when you hear about AI, you'll hear a lot of hype. But in healthcare, we have more responsibility because we have the lives of people in our hands. So our operation frameworks really ready to adopt AI on a large scale. The second thing is, as I've been repeating many times during this presentation, we need to know who owns the risks. Who owns the risk once the tool is deployed and becomes part of the daily workflow. At this point, AI is not just generative AI. We have AI agents. So once you have an AI agent that can think independently, we have to understand what is the risk and who will own that risk. The third question will be, let's look at our data and our data environment. Is it safe to support AI use? What data are we comfortable to use within our AI platform, or are we completely uncomfortable? And if we're completely uncomfortable, we need to ask ourselves why and what to do with that feeling. The fourth question I'd like for you to go away with is adopting AI within your organization able to create measurable results, or is it also able to prevent you from introducing more risk that you are unable to handle as an organization? So this is one of the most important questions. Does it have value, or is it just more risk for us? The last question will be, let's look at our leadership infrastructure, the way that we report to each other, the way that our leaders work together. Is it able to scale AI responsibly without feeling that we have unavoidable risk that we cannot control? So those are some questions I believe that you will find helpful. So to end, I would say, because as I was saying earlier, when we talk about AI, we talk a lot about tools, which one works better, which one can we integrate within our workflows, and how do we use them. But that's not really what's important for leaders. It's really thinking about the foundation. Is our organization ready to use the AI tools we thinking about buying, and are we able to mitigate the risk once it is introduced? And after the session, I will share with our host AI Readiness in Healthcare Operations Scorecard that you can use to see where your organization stands. And if you're interested in it, right now we're refining it, so it's a little easier for you to navigate. Once it's ready and it's live, I will share it with you. So if you're interested, you can send your information in the chat or directly to our host, and we'll send that over to you. Thank you so much. And that's my contact information. I'm open to questions if there are any. Oh, you're on mute, Lowen.
Thank you so much. I can tell you one of the takeaways was, don't allow AI to be so scary. And to also quote you, part of your organizational structure should include critical thinking. I love
It
that.
does.
I love
Yes, it should. We should never let go of that. Yes, yes. Thank you.
that. I truly love that. We're going to share this conversation far and wide, and I'm sure questions will filter in at that point. They usually do. I really
Mhm.
want to thank you for your time and
Thank
your
you,
effort.
Ray.
And for those watching now or the recordings in the future, if you would like to continue this conversation, please reach out to ASSI or Advanced Support Services. We will happily connect you to the Dumontel Healthcare consulting team, and we look forward to the next engagement. Again, part of your organizational blueprint, structure, ideology should include critical thinking. And with that, we thank you so much for joining us today on this advanced workshop, and we'll see you soon.
Thank you so much